Hello and welcome to the Health For Mzansi podcast, where we explore the stories of those transforming the world of health and medicine. Today we have the privilege of sharing the remarkable journey of Dr Yashka Singh, a medical professional who is not only dedicated to patient care, but also finds rhythm and balance in dance. Her story exemplifies resilience, adaptability, and the relentless pursuit of healthcare reform. Dr. Yashka Singh, it is an absolute pleasure to have you join me here on the Health For Mzansi podcast. I came across your profile on one of the social media platforms and I said to myself, I have to interview this doctor. She looks so cool. Thank you so much for joining me and thank you so much for being part of celebrating, South Africa's, what we like to say, health heroes. Welcome to it. How have you been?
Thank you so much for having me. I think this is such an incredible opportunity. And I'm really excited because I've never done anything like this before. So thank you, actually.
You grew up in Benoni, attending Benoni High School. Maybe you can tell us more about, your early influences and your early years and kind of what shaped your decision to pursue medicine. Maybe you can tell us a little bit about your family and your growing up years, some special memories as a start. Thanks.
Most of the time when I tell people I'm from Benoni, like in Joburg, it's a funny thing if you come from the East Rand. You'll always joke about like they have to stamp their passport to come and visit you or, it's like in just one of those areas people usually don't want to say that they're from. But actually, I really loved growing up there. There were so many things about it that I think were so special. So, of course, I know we consider ourselves the born frees, right? Since we were born after 1994. And my parents grew up in those areas where it was still pre-apartheid times and they had like their own close-knit communities where it was racially divided and stuff like that. And then we were then the first generation to then be afforded the opportunity to grow up outside of that. I was very lucky, went to a multicultural school, multiracial school. And growing up, that was a really good opportunity to know a bit more about our country just by being in a school where you're surrounded by people who came from all different parts of Benoni. I know it sounds crazy, like I'm saying as though it's the whole world, but like different parts, they had different upbringings, but we all got to learn a lot from each other in that way. I don't know when I properly decided that I was going to be a doctor. I think at some point in life orientation, they're always asking you, what do you want to be when you grow up? And I always just thought I was going to be a dancer. But at some point I was like, hey, wait, I want to be a doctor. From the time I made that decision, I must say, in like Benoni High School, the school that I went to, my teachers were all very supportive. They tried to push me in like the science subjects, to work hard, help me to achieve the marks that I needed to get into medical school. And yes, I really had a good time in my high school and growing up in that area.
Of course, it does sound like a kind of a little world on its own.
That's where Charlize Theron is from, right? So,
okay. I mean, besides your teachers kind of influencing you and encouraging you to work really hard in your pursuit of to go into medicine, what about your family? What influence did they have? And of course, dance is so much of who you are as well. As you mentioned, you thought that you would just be dancing and now you've kind of combined your medicine and your dance all in one. Were there any like particular values or lessons from home that have stayed with you throughout your career?
I would say my family, speaking specifically about my immediate family and including my grandparents and stuff, their influence was always heavily just on hard work and dedication and discipline towards whatever career path you were choosing. There was no pressure to become anything specific from my family. It was more like you're going to school, there's a big focus on education, you need to work hard, you need to study hard. You need to achieve good marks in high school, in primary school, so that one day when you decide what you want to further study or further pursue, you've already set like a really good foundation for that. And I mean, I think those values came from my parents, definitely, and even my grandparents. We used to go to my grandmother and grandfather's house after school. My grandfather would always make sure we'd have like lunch, we'd get like maybe a short little break time, and then it was homework time. There was no messing around. Didn't matter that we were just like in grade 3 or 4, you go and sit and you do your homework. They've always been supportive in that way and definitely instilled the value of hard work and dedication. And I think that those are two very important qualities that you need to have in order to be dedicated to pursue a career in healthcare.
jumping from high school, you graduated, from WITS in 2019 and then started your internship during the COVID-19 pandemic in 2020. How did the pandemic impact your early career? Obviously, it affected everyone in a huge way, but were there some big lessons that you took away from this period?
It's such a surreal time to think about because it feels like, one, it happened so quickly, but while we were experiencing it, it felt like it was never going to end. And when I reflect on the time, I realized that I had to grow up as a doctor very quickly because I came from, and I think everyone who worked as their first year of being a healthcare worker across even the allies, physios, everyone who was a healthcare worker for the first time in that year, it was a massive jump. So already it's a big jump from being a student going into the career for no matter what career you did. But now we were faced with this additional challenge, which was not even just an epidemic or a small outbreak. It was a pandemic. And it had its pros and its cons in shaping me into the doctor I am today. Definitely when I say it made us grow up quickly. There was no time for us to still be like with that student mentality, like we're here to still learn. We're still going to, do all these things that you do as a juniors, because the amount of people that were sick, the amount that the hospital needed like extra staff to rely on, we had to like pull up our pants and just be there, be doctors from the get-go, be there trying to learn from our seniors, doing the things that they needed us to carry out. We hit the ground running. So in that way, it made me learn immediately what it means to be a doctor. The challenge it provided us with in a medical sense was also quite a big one because we only really ever saw these pandemic things on like an episode of Grey's Anatomy or something like that, where you watch that episode where they lock down the whole hospital and stuff. But to be in the middle of it, it's quite an unreal experience. And I don't even know if I have the words to describe it. Up till this day, we saw a lot of death. And I mean, I knew that becoming a doctor would mean that you see people dying around you. It's something that happens. But to see death at that volume, at that rate, to see people who you never expected to die. You admitted them, they were talking to you at night, and then you come in the morning and you see their bed is, filled by another patient, only to hear that they just died overnight suddenly. It was quite a big shock, even emotionally. It also taught to make sure that there's some kind of outlet for the grief and for the traumatic things that we go through and that we see on a daily basis. I still struggle today to say exactly how I feel about it. But I definitely think that it made me learn very quickly how to face these difficulties in medicine. Even our most senior doctors, for them, it was also something new to navigate, So we all had to contribute towards problem solving and leading our teams through it and just leading our colleagues through it or, being a part of the team and taking instructions. So it definitely shaped me a lot. And I'm sure that most people who were healthcare workers or even frontline workers at the time can attest to that.
I'm just listening to you. I'm just also kind of reflecting on just other doctors talking about this time and how difficult it really was and many similarities of what you're saying. Like you're just in it and you're going through it day by day and you can't really grasp how big it actually was. And so thank you so much for sharing. And thank you once again for your service during this time and what you continue to do within the healthcare sector. Now, if we could just maybe go over a bit more of your timeline. So after COVID, and after completing your community service in KwaZulu-Natal in 2022, you then navigated, various locum roles before securing a position at Klerksdorp Tshepong Hospital Complex. How did each of these roles kind of contribute to your growth as a medical officer and prepare you for internal medicine?
I definitely think the foundation years of internship and community service played a massive role in it. That is what our government's mandatory training period is. And I must say, I thought that it really did prepare me well to be what we now call ourselves independent practitioners after completing our community service. I did a lot of locuming, and the reason for that was actually because I couldn't get a government post straight out of community service. And I'm not sure if you've heard about it. There was a big struggle, and still is like a big struggle to get posts. Whereas previously it used to be a lot easier to just get a post in the department you wanted. But as with most things, there's job shortages and things like that. So I ended up locuming. I did a lot of emergency department locum work in the private sector. And I think it was a big jump because I came from rural community service to work in private emergency department. But it taught me a lot about the opposite side of the healthcare system in South Africa, how things work in private, how patients are serviced and treated there as compared to government hospitals. And I think it just exposed you to a different set of resources available. And it helped me to kind of refine my skills in a resource-rich setting as opposed to a resource-limited setting. Whereas internship and community service, I learned maybe how to be a bit more resourceful. So I think both ends of the spectrum kind of shape you into realizing like, okay, hey, if you don't have the stuff available, this is how you treat the specific patient. You do A, B, and C. But when you're in a resource-rich setting, you can jump immediately to X, Y, and Z because you have everything available. So now that I'm kind of like in the middle in a tertiary setting, which definitely has a lot more resources than I did have access to in community service, I still have got days where I had no resources backing me. So sometimes when I'm faced with problems with resource limitation in my current career, I can see that sometimes I have a bit of an edge over those people who've only worked in places where they've had these things available, you know, like you make a plan. And so I think that it's shaped me in that way. And it's also given me exposure to understand the vast spectrum we have of healthcare services available to patients in South Africa. Yeah.
Thanks. And that actually is kind of a lead into my next question. And I also want to go over kind of your certifications that you've got and some of the highlights in your career. But just to kind of keep that thought around some of the challenges, you know, the healthcare system in South Africa has its share of systemic issues, often linked to broader governance challenges. And if you can maybe just talk about kind of specific areas in the healthcare system that you feel need urgent care, kind of just looking at the spectrum and kind of seeing where you've been placed before and where you went to and where you are now currently. If you can just go into a little bit more detail in that as well. Thanks.
It's such a broad spectrum. It's so hard to say exactly what, but my own opinion of it would be one of the things I think that we really need is good electronic record keeping, for example, because, well, let's say that patients who access government or state health facilities often don't have enough money to get private medical aids and, you know, go to private hospitals. So they end up in hospitals or healthcare facilities based on the area that they live in. But let's say, for example, they end up in another province over the holidays or something like that. It's almost crazy that you will be there and not be able to access any information about this patient. Whereas if you're in private, you could probably pull up an electronic record of this patient's medical history, which can help you a lot with your decision making. And I think what then happens is we spend a lot of time in our hospitals trying to find out all of this information, which some other doctor has already obtained, these tests that have already been run. And, you know, it just delays patient care a lot. So that's one of the big things that I think is quite important. Resource allocation, of course. I feel like there's these people who make the decisions about where money should go towards and what's the most important aspects of the healthcare system that require money. And I often feel like those people have never been on the floor, because if they came to ask the people on the floor, maybe spend like a month or two working with them, they would realize what we actually need. Sometimes it feels like there's a whole lot of money going into unnecessary places where it could be of better use somewhere else. For me, the biggest issue with the healthcare system is staffing. We are chronically short-staffed. You will go to any department and people will be like, we don't have enough doctors to allow for the department to run smoothly all the time, or there's a shortage of nurses in your ward one day, so the doctors also need to be the nurses. There's no porters to push the patients. There's no messengers to take things from one ward to another. And because each area then ends up being short-staffed, other people have to make up for that staff shortage. And it just perpetuates that cycle of patients having to wait longer for everything that they need getting delayed by days or months or whatever. The government has all these programs that they say we're producing so many doctors, we're producing so many nurses. But have they looked at how many of them are sitting without jobs at the moment? Or they want to create a new medical school, yet there are so many unemployed doctors in our country at the moment. So where exactly are we going with that? And I think those are the critical things that need to be looked at.
Thank you so much for pointing out, you know, these key elements for someone that's actually working in the industry. This kind of highlights where we need to be moving to. And I trust and pray that we can move towards it, I mean, in your lifetime, and at least change over time. So thank you so much just for shedding some light on that as someone in primary healthcare doing the work day to day. You have touched on this, and I kind of wanted you to just go into a little bit more. You working in various settings, from rural hospitals to high-pressure emergency departments. How have these kind of experiences shaped your approach to patient care and teamwork in diverse environments? If you can just give us some tips, or maybe if someone is listening who wants to be the next Dr. Singh, what advice would you give?
I was very fortunate, crazy enough to say this, but like to be placed in a rural facility for my community service, because it really, really taught me the value of health in a community level and working so close with your team in order to make sure that the community's healthcare is well looked after. I must say, like, the nursing staff and even the allied staff in these settings, they are all there for the patient. The primary goal of every single person in those hospitals is to care for that patient. And we are far from the nearest tertiary hospital, so we're all relying on each other to do our jobs to the fullest in order to care for that patient. And I think that being in that rural setting, it really taught me that when all members of the team function as they are supposed to, we can actually make a massive difference. And a small example I can give of that is that we had a really good team of allied healthcare workers over there for occupational therapy, physiotherapy, speech therapy, audiology, etc., and including dentistry and the dietetics teams. And those guys and girls would come to our ward and see the patients, even if we had not specifically referred them, for example, and screen them themselves because it's their field of expertise. They would then come and screen these patients themselves and then, be able to come up to me and be like, hey, Dr. Singh, by the way, you didn't refer this patient to me in occupational therapy, but I just wanted to let you know I can actually do this, this, and this for them. Whereas I think in tertiary facilities, everyone is so busy all the time. They will only come and see a patient who has then been referred to them. So those experiences shaped me, number one, to respect the role of every single member of the team and realize that, as a doctor, you cannot do everything alone. You are just one role in that patient's whole journey through the hospital. And yes, your role is a very important one, but you also need to acknowledge that there are so many other people and so many other professions that play a role in this patient's care. And if you think about it and have respect for them and learn from them as well, you can actually do so much more for your patient than just the medical care for them. And I must say that I really think that changed me a lot because it helped me to grow in that direction after my internship. Whereas in an internship setting, we did focus a lot just on the medical management. There is obviously all this other holistic multidisciplinary management, but it came out a lot more in a rural setting. And then I'd say moving to private also taught me like how we can also, again, still rely on a team that's working all together in order to make sure our patients get the best care that they need. Those nurses were always trained. Their courses were always up to date. And, sometimes even you'd be in a resuscitation situation and a nurse can step in to give you the best advice that you as a junior doctor need to learn to take that advice from people who've been in the industry for much longer. I must say, I think being in these various or diverse environments and all these different teams have taught me the value of teamwork and how important it is that if you really truly work towards a multidisciplinary team, you can do a lot more for your patient than just trying to see them by yourself.
Thank you so much for that. You've really painted a beautiful picture just in terms of your growth and kind of your professional journey in healthcare. And I'm sure there's highlights that you want to share, kind of like key moments that you celebrated. And I know during your internship and community service years, you were awarded the Distinguished Intern Award and also served as a group representative multiple times. What do you think has driven you to take these leadership roles and what impact did it have on your professional growth? Maybe you can also just share some other key highlights throughout your journey now since you started as a doctor.
I tend to go towards leadership roles mainly because I would say an extroverted extrovert, but I've always just been drawn to those roles. And the main thing for me is to try and create working environments that are positive, that benefit all of those involved, that are fair and just, and also that contribute towards making a department more efficient. And so I often found myself in these leadership roles so that I could try and be in a position that would allow me to actively make changes within a department or within hospital if I could see that, maybe something needed a little bit of adjustment. And I think that something you can do from the sidelines, but it's a lot easier to do when you already hold that leadership position or an official kind of leadership title, because it's a bit easier to effect change from a position that's sort of like seen as a position that's given to you or that you've been elected for by your group to represent them. So it just helps to maybe effect change in a bit of an easier way and to go through the correct channels to do so instead of trying to fight a losing battle just from the sidelines.
And then you've also, done or gained various certifications. You've done it in advanced cardiovascular life support, pediatric advanced life support, advanced trauma life support, and a diploma in, HIV management, among others. Why did you pursue these, specific qualifications outside of your studies, and how has it kind of enhanced your capabilities as a doctor, specifically working in emergency and internal medicine?
A lot of the life support courses are part of our compulsory training, actually, and they also benefit you, obviously, when you apply for jobs in the future. They look to see, have you taken the time to, go and get some additional training on life support and important cardiac or trauma or pediatric related life support, because it just also shows that you have an interest in improving your own skills. I would say definitely, as we spoke about the COVID pandemic earlier, the cardiovascular life support and the pediatric life support courses were so, so important in doing resuscitations of like these COVID patients. And although it just enhanced your skills in general for a resuscitation situation, which you face a lot from the time you're a junior doctor, sometimes it's just you alone, maybe even on your first week of being a doctor. They will call you first to come and start the resuscitation of a patient. And these courses help me, to feel a little bit more confident when I'm called to the situation and to at least know exactly what I should do, where I should start. And yeah, like I said, in the COVID pandemic, we were doing resuscitations, I promise you, like maybe 5 or 6 in a day at a time. And it just really helped to refine those skills and make sure that you were doing the best things that you could do for the patient. Again, also, like I say, being placed in a rural setting for community service, it also made sure that even when we didn't have all the things that are available to us, we knew how to try and keep the patients alive as best as we can until we could get them to a place where they could get further treatment with better resources. And maybe you can still learn these things without these courses, but it's always good to have attended a proper course with, training material and practice exams, that you can make sure that you're giving the patient the best care that you can possibly give them.
And then, Dr. Singh, I have been stalking you on social media. And I know that dance is such a big part of your life, dance and choreography. So maybe you can tell us a little bit about that, the specific dancing that you do, and more about, how does your work in dance, complement or contrast your role in medicine? If you can tell us a little bit more about the dance style and all about it. Thanks.
My social media is mostly about me dancing, so that is very true. I have loved dancing from the time I was a kid, and I used to just dance randomly whenever there was music, and that's what motivated my parents to put me into formal training. So I did a classical Indian dance form, which is called Bharatnatyam. It's a dance form where we have a syllabus, you go for lessons, you write exams, there are grades. It's kind of like school. You have to go through each grade and you go up until you have a graduation. So I'd say that how they complement each other is that both medicine and dancing took a lot of discipline to get through all the grades, to get through all the exams, to be dedicated, knowing that the more you practice, the more time you commit to it, the better you're going to be. I also feel that the way that they contrast each other is that medicine is my career. It's where I like to put in a lot of my energy towards working for patients, learning a lot about the human body, learning a lot about disease states and how to treat them. And dancing is kind of my creative outlet where I can let out all this other creative energy that I have inside of me. And I often use it to kind of balance, the high pressure and stressful environment that comes with medicine. I always have an hour or two to look forward to after work where I can just go and release all of those emotions and all of that stress into a piece of choreography that just allows my body to move with the feeling. And it sounds so cliche, but I don't know if you dance or if you have like some kind of creative outlet, then you'll understand what I'm saying. It's just somewhere where you can channel all of that energy and create something really beautiful. Both of them teach you to be really disciplined. They teach you to be able to work part of a team. They teach you to be adaptable. So I think the skills I've learned in both of them help me in each department, surprisingly.
I can hear you smiling while you're talking about it.
Yeah, I really love it.
Now, my last and final question is just around your future. You have expressed interest in terms of kind of hospital management as a future career path for you. Where do you see yourself in the next 5 to 10 years besides dancing away? More specifically about your medicine and your career in the medical sector.
My current dream is to become a specialist physician, and that's why I am in the Department of Internal Medicine. So that will allow me to pursue the career of becoming a specialist physician and potentially subspecializing in one of those things like cardiology or endocrinology or something along those lines. But I do have a very, very high interest and a very keen interest in management. And I think this goes back to like saying all the leadership roles that I do enjoy, all of the leadership roles that I have tried out for or been nominated for. The thing is, I sometimes really struggle with the frustrations of healthcare systems not working. And I always can think to myself, if I was the manager of this department or of this hospital, this is how I would do things differently. And I feel like also a whole lot of us as healthcare workers will have that conversation with each other every few days. Like, if I was the manager, I would make sure that this gets done or this gets done or this gets done. But very few of us actually go on to try and be that manager. And I think it would give me the opportunity to effect change on a larger scale than just being, just working as a physician, just amongst patients. I'd be able to maybe change the way an entire hospital runs and try to adapt a hospital to a resource limited setting, or just, try and make everything work a bit better for the patients. And I know sometimes people can say that that's a very optimistic or idealistic view, but I think that a lot of the people who have made big changes in whatever careers they are in had these, optimistic ideas and pursued them. So I'm really hoping that one day I could get into some kind of a management role that ensures that I can positively impact the health of like maybe even an entire community just by trying to reface a hospital or coming up with innovative and more creative and efficient ideas on running a hospital. So it is one of the things I'm interested in. I'm trying to talk to people who are in those roles and how do I get there one day? Can I still be a physician and a dancer and a hospital manager? Is it possible? Because if it is, that's what I would love to do.
Dr. Yashka Singh's story is a powerful reminder that healthcare professionals are not just doctors. They are individuals who navigate complex challenges while striving for personal balance and professional change. From overcoming the hardships of the COVID-19 pandemic to working on the front lines of South Africa's healthcare system, her journey exemplifies dedication, resilience, and a vision for reform. Thank you so much for joining us on this episode of Health For Mzansi. If you enjoyed today's conversation, be sure to subscribe, rate, and leave a review on your favorite podcast platform. Until next time, greetings from me, Dor Numdu, our technical producer Megan van der Vent, and the rest of the team Health For Mzansi. Stay inspired.